We'd like to end today with a question and answer session on some of the less common PPE situations that might come up on calls, so that we're prepared for those kind of things as well.
Should all patients be instructed to wear a mask?
Yes, all patients, no matter whether they are COVID positive or under suspicion, should be wearing a mask prior to being in the back of the ambulance and while they are under your care.
What additional precautions should we take around our station during our downtime?
I think just like we're assuming that every patient we encounter might have COVID, we have to assume at this point that all of our colleagues might have COVID. You don't know where your partner was last night. You don't know who they were with. And it would be a very bad situation if everybody in the station were to get infected at the same time. So please make sure that you're wearing all appropriate PPE, walking around the station anytime you're within 6 feet of anybody.
Likewise, should we wear masks while we're up front in our response vehicles?
Absolutely. Everybody in the rig should be wearing a mask and eye protection unless they are in a cabin that is completely separate from the patient care area. Hang on, maybe I misinterpreted that question.
No, that's exactly what we want.
Okay.
No, that's exactly what I was looking for.
So I think the other piece of that answer is that if you and your partner are both riding in the cab to a call, you should be wearing PPE because you're within 6 feet of another person.
Can you review proper mask usage, AKA how to wear the mask?
So this is how you wear a mask. This is an improper way to wear a mask. This is a very improper way to wear a mask. And this is not wearing a mask at all.
Can you speak to situations where a patient might need to receive Narcan or where we have an agitated patient?
Agitated patients and administration of Narcan should both count as aerosolizing procedures. So the appropriate PPE should be worn, including an N95 mask, face shield or goggles, a gown, and gloves.
And can you demonstrate how to properly remove PPE or speak to the proper steps of removing PPE?
After you complete your handover at the hospital, we would ask that you take your stretcher into the decontamination zone to get everything cleaned off. And at that point in time, go ahead and take off your PPE. Every time you take off part of your PPE, you should wash your hands in between each step. That includes your mask, that includes your face shield, that includes your gown. So when we get to the hospital and we transfer care over to the emergency department staff, we have to decontaminate ourselves from this personal protective equipment. Our suggestion would be to first take off your gown and outer layer of gloves prior to leaving the room. To do that, simply pull forward, bundle it away from you, and dispose. Remember, after every time we take off a layer of PPE, we're going to wash our hands. Then we're going to step out of the room. We're going to take off our face shield. We're going to decontaminate our face shield, and we're going to leave it to dry. Again, we're going to wash our hands between that process. The next thing to do would be to decon from our mask, making sure that we're going to pull the mask away from ourselves. We would decon, wash our hands. When they're dry, put this up and over and push the mask away from you. The final step is going to be to take that final layer of gloves off. Again, it would be just how you would normally take your gloves off. You'll dispose of that in the trash, and then you'll wash your hands. The goal is to make sure that we're decontaminating ourselves, but also not contaminating the rest of the hospital. We would go ahead and take our stretcher out immediately so it's not in the hospital and decontaminate it from there.